Welcome to a special edition of She's Well. As we step into the October Breast Cancer Awareness Month, we take this time to honor the strength, courage, and resilience of the women who have faced breast cancer. Today's episode isn't just about the statistics or data. Instead, we are focusing on the personal stories that highlight why early detection and the regular screening are crucial. I'll start with the first story of my friend, Dr. Noor, a passionate advocate for breast cancer screening. She spent years telling everyone around her how vital early detection was. Yet, ironically, she never get around to her own screening. Always busy with her patient, she delayed it until one day she finally went for a mammogram and she discovered a small tumor. It was humbling moment. Luckily, it was caught early and now her advice comes not as a concerned doctor but from a place of hard-earned wisdom. Here we have more stories to tell.
Okay, hello. The history that I will tell you is about my best friend. She has about 33 years old with and has a baby, 1 year more or less, and always focus on the baby, the family. And I told her, you did the checkup, you have every woman after 30 has to have at least an ultrasound. She said, no, I don't have time. My baby demand me a lot of time. My husband, family things. I have to cook. I have to go to supermarket after. Then she came one day, Dr. Nancy, my friend, I have a lump. It's not pain, so it's okay. Come to see me, please. We have to see. No, I don't have time, but it's not pain, it's not pain. After a couple of months, Nancy is a little hard, is bigger, but this is not pain. But something started to go out and discharge from my nipple. So I pushed her. And sadly, I found a very big mass, painless, not painless. The pain was because it was bigger. And the blood discharge. And okay, we continue doing our diagnosis. I pushed her to do everything. And it was suddenly it was breast cancer. She has in this moment she had a 33 years old, so very aggressive, and that's why growing a lot. So then remove chemotherapy and all the story. Was advanced, so sadly she couldn't manage after 3 4 years. After sadly she passed away. So
Very sad.
the important things here is first of all, if you want to take care of your family, take care of yourself.
Layla was one of my very interested patients. She was a fitness coach. She has a perfect lifestyle. She go every day to her gym. She have a very healthy eating lifestyle. She eat fruit, vegetables, and she never get on her mind that she can catch something like this or breast cancer one day. During her routinely mammogram, we discovered a small early breast lesion, which is diagnosed at Z as an early breast cancer. She go well through the medical treatment and she cured from it. What I want to say is that if you have a healthy lifestyle, if you are eating good, this doesn't mean that you cannot catch cancer or cancer breast. Early diagnose and early management is a true solution for this.
Shaima was one of my best friends. She was very close to me. And one day she was just passing by me in the hospital. She just told me that she's having some discomfort. And by that time, we had this promotion for the screening. She went for, I told her, okay, just come for checkup. And we just take her for a mammogram. And by that time, I found a very early breast cancer. I took her immediately to do everything, the MRI, the biopsy, everything. And I took her to the surgeon, and it was just like a shock for everybody. She was just not complaining at all, and she just coming with some discomfort, and I was only promoting that she will just do her regular checkup. And by that time, she got an early cancer, and she didn't take any chemo because her type of cancer was just treated by radio and some hormones, and she cured very well. After a few months, she was just doing very fine. Every year, she's coming for her annual checkup. My point here is to say that when you turn 40, you have to go for your annual mammogram. You have to go for your checkup because she didn't have any kind of risk factor, no family history, nothing. And then, of course, it was a disaster by that time, and it was a shock for all the family. And then she cured, and she's very well. And now we are just enjoying our life as if nothing happened, and every year checkup, and that's it.
Nadia, Laila, Noor, they aren't the only ones. Our community is full of the women who face similar battles with the breast cancer. These stories remind us that the early detection is essential. Now, I would like to introduce some of my amazing colleagues who are not only highly respected doctors with impressive careers, but also passionate advocates for the breast cancer awareness. And they don't just talk about the importance of screening, they lead by example, prioritizing their own health and encouraging others to be the same.
Hello, everyone. I'm Dr. Nancy Molon. I'm from Argentina. I've been in a radiologist field. I'm radiologist doctor for about more than 15 years, and working in America, in South America, and in Africa as well, in Luanda, and now in Middle East.
Hi, good morning, everybody. I'm Dr. Tamer Salama, consultant of general laparoscopic and weight loss surgery. I have more than 20 years experience in general and laparoscopic surgery.
Hello, everyone. I'm Dr. Marwa Shaban. I'm from Egypt. I have more than 20 years experience in radiology, and I am specialized as an intervention breast radiologist. I'm working now in the Middle East for more than 15 years.
I'm Dr. Bushra Gul, OBGYN specialist with more than 2 decades experience in the OBGYN, and I'm the founder and the host of She's Well, your health education forum. So, hello everyone. It's amazing. My colleagues here at One Roof, normally in hospitals, we don't get to see each other's a lot. So, everybody's concerned that what about the breast cancer? What could be the screening? So, what do you think about the risk factors about the breast cancer? Yeah,
Yes.
risk factors. Yeah.
The risk factor, the most important risk factor is the family history. Of course, if you're having a family history, mother or sister as a first degree, and then the maternal side is much more important for as a family history more than the paternal side. The other risk factor also, if for example, she's taking hormonal therapy for any reasons, there is a lot of reasons that a woman can take hormonal therapy. There is other factors like obesity, that the nalipara, the one that never had children before, the one who never. There is a lot of risk factors. It's just a risk factor. They are not causes. There is a big difference between having a risk factor and a cause.
Yeah.
So, of course, and at the end, I want to add that cancer can happen even without any risk factor.
Yeah, nobody's invincible.
Nobody is in.
So some people say that deodorants can cause. So what's your take?
No, we have a lot of women every day, so a lot of questions, a lot of misunderstanding. Do a mammography cannot cause cancer. Do X-rays cannot cause cancer. The sonogram cannot cause cancer. Cancer can be happen in anyone.
Exactly.
And the most important things is not pain. When you have pain, go to the doctor. But cancer is silent. It can happen at 30 years. It can happen at 28 years. It can happen at 60. It can happen in all the range of all the women. So, which is our point? Cancer can be there near you, beside, in your mama, in your sister, in your daughter as well. So at least go to the doctor, and if you have 20, 22, 23, 25, an ultrasound at least will give you a baseline.
Yeah, that
So
should be done.
after this, you say, okay, no, at 25, I have this lump, but I had it. You are not going to come at 55 in a new lump. So go to everything because it's not the same.
Right.
So the important things is everyone has to do at least a baseline ultrasound when before get 40, and after our screening, as everyone knows, and has to be know for everyone after 40 screening of mammography.
yeah.
That this is the same, different as well.
Right. Dr. Tamer, being the obesity specialist, what do you say about that?
See, let me tell you some secret, Dr. Bushra. The point is we have a modifiable factor, risk factor, and non-modifiable risk factor. And non-modifiable risk factor, like what Dr. Maro said, family history. This is, we cannot do anything with it. Although that the presence of this risk factor, this doesn't mean that you should get the disease. Okay. So let me go back to modifiable risk factor. One of the most important of this risk factor is the obesity. Let me tell you some secret that obesity is associated with 20 to 25% increase in the cancer breast as a cancer as a whole, and especially cancer breast in the female. Let me tell you another point, that with the decrease of 5% of this extra weight, there is association decrease from 10 to 15% of the cancer breast in the female.
It's very big.
So this means there's a direct, more or less, there is a direct relation between obesity and with cancer breast. What the point is, we don't have a fact or background about this association, but I believe that you know that obesity is associated with some sort of chronic type of inflammation or chronic inflammation, which is associated with immunomodulation. I believe this immunomodulation and this immune effect or immune disturbance may be play important role in the association with cancer breast.
I guess lifestyle modification nowadays, in this era where there's sedentary lifestyle, too much of the food, it's affecting everything, hypertension, diabetes, even the cancer. Now, being obstetrician, I would say breastfeeding is also one of the risk factor as a protective one. So if you have children, choose to breastfeed to protect yourself from the breast cancer. Now, we talk about the risk factors, what is modifiable, what is not. Let's talk about the screening, what people have to do actually. So clinical first is the breast examination. That could be the self-breast examination that women does every month after periods to check whether they have some lump or not. Do you have something to say about the self-breast examination?
The breast examination, actually, it's very useful. Every woman, after her period, every month, to get herself checked.
Yeah.
Month by month, she will feel her breast. She will know if there is anything will change. Because sometimes the breast is dense, which means it's lumpy. So she feel like there is a lot of lumps. But month after month, she will get used to her normal breast, and she will feel if there is any difference. So I advise every woman to make herself checked after the period, under the shower, so that it will be a little bit lubricant. Or she can just put some moisturizer or something, some cream, so that she can feel her breast. It doesn't take more than 2 minutes. So if every month, 2 minutes, she will, it's like a routine, like a monthly routine. So it will be easy for her to catch any difference quickly.
Wow. As you said, to get to know the baseline,
And why after period? Because normally in period, most of the woman has pain.
Yeah,
So, and where,
due to bloatedness, due to water
is the pain?
retention.
Because most of our patients came with, I have pain where up near the axilla, upper outer quadrant, in the outer side.
Right.
It's normal, this kind of pain, because there's more concentrated the breast tissue and it's more sensitivity. So after, in between the period or little in the days before and during the period, we have more pain. That's why after menstrual period.
Yeah. So clinical breast exam, because We being in the clinics, we get to have a lot of women coming for clinical breast exam. What's your take on that, Dr. Tamer?
Let me tell you something. We have three levels of breast examination. Self breast examination, which is done by the patient herself.
Right.
And this should be done, as my colleague said, every month after the period.
Yeah.
And we have a clinical breast examination, which should be done by physician or surgeon, whatever, in the clinic, which before 40, it should be done at least one every year. And after 40 or above 40, it should be done at least one every 6 months.
Wow.
And finally, the radiological assessment, which I believe below 40 should be done at least between 1 and 2 years, and above 40 at least should be done once yearly.
Yeah.
This mechanism or this assessment under the umbrella of triple assessment, which is a part of early breast cancer detection program. This is a very important point for early detection of breast cancer so we can manage it early.
Yeah, I was in one of the talks and there were guys sitting in front row and they were like, what we have to do. So what they have to do, the guys, male.
Let me tell you something. The cancer breast, incidence of cancer breast in male is less than 1%, although it's very low, but still present. But it has some criteria. First, it's much more aggressive than that in the female. Usually, if we discover it, we discover it in late stage. It may be early metastasized, and it's aggressive a little bit than if we said that the cancer breast in female is more or less is now a curable disease. In female, it's a little bit difficult. So, again, the cornerstone or the keystone in the male cancer breast is the early detection in KCF.
Again,
is less than 1%. Is more common in old age, like above 70, above 80. And if you feel any change or anything, you have to investigate early.
Yeah, right. So now the ball goes to the court of radiologists. What you want to say about the mammography, because you guys do a lot of mammography and the ultrasound.
Yeah, mammography. Usually women are afraid from the mammography because they think it's painful.
Right.
The pain in the mammography, there is some discomfort. It's it's variable from one woman to another because every woman have a different breast than the other because it's like the content of the breast is different from one woman to another. So the pain level and discomfort will be different from one person to another. But it's just a little discomfort. Plus the new machines and the new technologies now, the compression we are using are much less than before.
Right.
So the big compression done before and the pain is not there anymore with the new machines.
Oh.
So little discomfort once a year will save a lot of effort and a lot of things.
So it's not pain per se,
no,
just a discomfort.
It's just a discomfort. And as I told you, you cannot know how discomfort it is unless you try it
through
first.
that. Yeah.
So I encourage every woman to go for her mammography. See how, of course, with new facilities and new machines, the discomfort level is much
lesser.
So you just tolerate little discomfort,
right?
Rather
amazing.
Than having something.
So everybody
more.
have this message that it's just a little and discomfort, not the pain. So when we do the scan,
this thing's another point that I want to tell everyone. Can I not do mammo? Can I do echo only, ultrasound only, please? And no. Ultrasound, that's why Dr. Tamer said correctly, you have to go to your physician because there is a lot of criteria. And as Dr. Marwa said, each woman is different. You have this different risk factor. You have different style of life. You have someone are not has children, another yes, breastfeeding, and 20, 30, 40, 50 different. So this criteria is guided by your physician, not by you. Okay, I will choose mammo. I will choose no. First of all, and second, are complementary. Things that Dr. Marwa and me are doing and are seeing in breast ultrasound is not the same that we are looking for in a mammo. That's why after 40s, we have to do a mammo. This is our map.
Yeah.
And then we decide as radiologists, this map need complementary ultrasound. This map need another things. And why not before, not at 30s?
Yeah.
Because as Dr. Marwa said, has a lot of breast. The breast is dense. And a photo cannot say, because a mammography, X-ray, that all this is a photo.
Yeah.
So it's not in life, and all the breasts are in one photo. So mostly of the breasts before 40 are not giving us a lot of information as radiology.
Yeah.
So that's why the criteria, international criteria said most of the women after 40 has to do mammography
yeah.
because the breast is more fatty. It's
Yeah.
transformation.
Less dense. Yeah.
Okay, breast in woman is not after 40. And then before ultrasound, because has more sensitivity. Okay, so my point is not one or other. Is if you have less than 40, ultrasound. If you have after mammography baseline, then your physician will decide how to continue. Thank you.
So after 40, mammography is mandatory, but ultrasound could be supplemental.
Exactly.
So what about the MRI? So what you guys have take for MRIs?
Yeah, MRI is little complicated procedure.
Right.
It needs more time, and it's not used for every woman.
Right.
There is certain criteria for using the MRI, and that's why, as Dr. Nancy said, a patient has to consult the physician. The physician will put the plan for what to do next.
Right.
So the MRI we do in certain only people, and with certain findings in the mammogram and ultrasound. Not in.
Right. Especially the one with the family history. I
No,
guess it's important, yeah?
Yes, the thing is the message. Because we have a lot of these actresses that say, I do a mastectomy, I do MRI. So in breast, more is not best.
Yeah.
MRI can cause, because I have a lot of patients say, I want everything. I want MRI, it's better. No, it's not like this, because can give you bad information.
Right.
So in the case of breast, that's why is a specialized, is a unique. Like Dr. Marwa, we are all specialized in only breast, because it's a big difference. It's homemade.
Yeah.
It's not a receipt for everyone. This is the receipt for do a cake. No. Each woman is different. That's why it's so important.
Yeah.
A mastectomy because my mom no. You have to go and consult. If you have mom, sister, and daughter, yes, you have a lot of risk. But not that this is not the cause that you will have. You have to go to one consultation, some genetic consultation. To see if you have the gene. Right. If you have the gene, we have to see if this gene is activated or not.
Right.
So it's a step by step that knowledge can give you power. And knowledge and faith can give you the fear. The fear can give you the freezing. And when someone is freezing, don't do anything.
Right.
So
mammography is on the discretion of the doctor after evaluation. You must be having a lot of patients with the implants. These are getting very common silicone implants. So what's special when we are doing screening with the implants?
Let me tell you something. There's a lot of fake information about the implants and its relation with cancer breast.
Yeah.
First of all, there is no fact or there is no direct relation between the implants that increase the incidence of cancer breast. This is a totally wrong information.
Right.
However, as my colleague Dr. Nancy said, the issue is if the patient with implant catch a cancer breast. Will be the issue. How to diagnose or how to approach, it's a little bit different from mammography. Here is one of the best indication for MRI, to make an MRI in patient with implant to detect cancer breast.
Right.
But there is no direct relation, and I should be clear in this, there is no direct relation between the implant itself and cancer breast.
Yeah. Is there something called implant displaced images? Are they more painful?
Look, there is a big myth that some people think that the implant, they cannot do a mammogram, it will rupture and these things. Of course not.
Right.
Because there's special technique for the mammogram to be done with the people with implants. So it's like a special technique. We displace the implant and we take the images without the implant during the mammogram.
Right.
And the mammogram itself, even with compression, it doesn't cause any implant problem. No, at all. And women with implant can do her screening normally like any other woman.
Right, right. You know, my patients, because I just let them know that my guests are home, like the famous clinicians, and they sent me some of the myths. So let's do the myth busting. So let's start with Dr. Nancy. Mammogram causes cancer.
No, not at all. Yes, we use X-rays, but no, cannot use because it's once, it's low dose, and is only 2 shots, and that's it. So 2 shots per breast.
Right.
So no, cannot cause.
Yeah, amazing. So have the message, mammogram doesn't cause cancer. Dr. Merva, mammograms are painful.
Yeah, as I said before, there is some discomfort, and I already mentioned that with new technologies,
she really
this
emphasized
is really,
on that, yeah. So Dr. Tamer, so if somebody doesn't have the family history, they cannot have the breast cancer.
No, it's totally wrong. You can, even if there is not.
Anyway.
There's always a starting point from which we are going to start. We don't know.
Exactly.
Which part of the family, we don't know.
Yeah, exactly. And which risk factor, and even without having any risk factor. So, Dr. Nancy, asymptomatic cannot be having the cancer. Person who doesn't have lump cannot be having a cancer.
No, of course. Cancer, as I told you, and the first is silent.
Silent disease. Yeah.
And started the important things is when it's silent. When it's very, very tiny and very small and it's not detectable even in palpation, the screening in mammogram and ultrasound is the only tool that will give you the information that if something is wrong there or no.
Right.
So that's why. And then if something is something like Dr. Marwa said about her friend, is it? It's early.
Yeah.
You took it, and that's it. You are good. This is the thing. You have a good life.
Right. Screening means asymptomatic. Screening means in the asymptomatic. So, Dr. Marwa, implants can rupture during the mammography or any exam.
No, the implants never rupture in the
They can't rupture, it's a relief for a lot of people who have implants.
Yes, of course.
Yeah. So, Dr. Tamer, implants can cause cancer.
No.
They cannot
Never.
cause
No,
cancer.
no.
You guys actually already emphasized most of this stuff. So, Dr. Nancy, only older women can get the breast cancer.
No, sadly no. As
Actually,
I
our
told you.
discussion was quite thorough. We discussed these all points.
That's why we need to start the screening with ultrasound after 30. This is the most, at least.
30, yep. Dr. Marwa, breast cancer diagnosis, whenever it comes to somebody, it means automatically death sentence.
No, of course not. Because breast cancer, when this is early, is just like very, very easy treatment. And as I told you in my story, people can live a normal life. Just annual checkup like any other woman.
Yeah. And actually, screening has a goal, and that is achieving the more than 95% 5-year or 10-year survival rate. So it is actually increasing the survival rate.
Of course.
So, Dr. Tamer, having mastectomy is the only treatment for breast cancer.
No. Nowadays we have much more advanced technique. We have much more advanced localizations for the small breast cancer with small local excision, and that's it.
It's a very minimal treatment.
Yeah.
I would love you guys to have some message to my audience. Dr. Nancy.
Okay. I hope strongly that all our informations and all the that we said today encourage you to come and visit us. As I told you, you spent a lot of time doing shoppings, go taking care about your family. But my point is, first of all, you have to be good. Because if you are good, you a mother of a lot of children, your wife, your sister, your daughter, you have to be good. If you are good, surrounded, all the people surrounded will be happy and will be good. This is the important things. Take care of yourself and came and do your checkup.
Thank you, Dr. Nancy. Dr. Tamer?
Let me tell you a good news. Cancer breast is nowadays a curable disease. What you have to do only to take care of yourself. We are here to support you. We are here to fight with you. Early detection is the key and the cornerstone for this curability of breast cancer.
Amazing. Dr. Marwa?
Yeah, I want to add something to my colleagues. The year is 365 days. One day a year, it has to be for you, only you.
So true.
So this day you have to go to make your checkup, because this will let you be able to give others the other 364.
Yeah. So now we have a ritual in our podcast because it's about She's Well, and these conversations go on. So we have a candle to be lit for as a hope that these all conversations go on and she stay well, being the center of the family. So I will give honor to Dr. Tamer to lit the candle. As we close today's episode, I want to extend my heartfelt thanks to you, my amazing colleagues, for joining us. Your insights and dedication to the breast cancer awareness are truly inspiring. Remember, early detection through the regular screening can save lives. Don't wait. Schedule your mammogram and encourage your loved ones to do the same. Prioritize your health today because it makes all the difference tomorrow. Thank you all for listening and stay well.